In this final video for Chapter 4, we're going to do a brief overview of some neurotransmitters and how they work. And just as a caveat, we're going to talk more about individual neurotransmitters and their role in specific psychological traits or disorders or functions as we go throughout the semester. So it's going to be a brief kind of overview so you know some of the names of neurotransmitters we're going to use later and kind of their category that they fall into. And then the basic mechanism of how they work and how drugs can influence them. And then later on, we'll get more practical about how these work in psychology. So if you're following my class, you'll see a table that looks a bit like this. This kind of just includes the list and how they work. And there's a number of things on here. I'm going to simplify that just a little bit for this video. So here's your somewhat shorter list. It's going to include many of the same ones from the last list, but there's one category of neurotransmitters called amino acids. And the examples that I want you to know here from amino acids are glutamate and GABA. Those are the primary ones. They're in fact the most common neurotransmitters in your entire nervous system. Glutamate is an excitatory neurotransmitter. It leads to EPSPs. GABA is an inhibitory neurotransmitter. It leads to IPSPs. And in fact, GABA is a little more common than glutamate is. We're doing a lot of inhibition, a lot of controlling of our brain activity, not just activating all the time. So these are really simple, right? They're amino acids. They get built very simply. They're not long chains of proteins or anything like that. They're really simple chemicals. They have really simple effects. If they're released at the synapse, they're going to excite or inhibit the other side. Cool? Glutamate, GABA, excitatory, inhibitory. The next category of neurotransmitters are called monoamines. And oftentimes, a drug might influence all monoamines because they're very chemically similar, or you might get a drug that's going to focus on one of them. But the monoamines are very important in a lot of psychological factors, and for that reason, lots of psychology students have heard about these already. We've got dopamine, serotonin, and epinephrine or norepinephrine. And you might know about epinephrine, and you also might know the term adrenaline. These are actually the same chemical. Typically, we'll use the term epinephrine when it's in the central nervous system, and adrenaline when it's running through our bloodstream through hormone release, but it's the same chemical, just in different places of your body. So these monoamines are pretty common. They're not quite as common as glutamate and GABA, but they're going to have effects throughout your nervous system. And dopamine, serotonin, norepinephrine are going to do slightly different things and be released in slightly different places in your nervous system that we'll walk through later in the semester. But these are in a category called monoamines. Acetylcholine, and it has its own category. It's a little bit different chemically, so it gets its own category. One of the roles for acetylcholine is that it's in your muscle junctions. So when a neuron connects to muscle to cause muscle activity, that's acetylcholine is going to be the neurotransmitter there. You'll also find it in your autonomic nervous system, pumping your heart and affecting your breathing in your lungs and that kind of thing. There's a category then, so these are the main ones you probably heard of: amino acids like glutamate, GABA, monoamines like dopamine, serotonin, and norepinephrine, and then acetylcholine you might have heard of. There's a category called unconventional neurotransmitters. These are unconventional because they oftentimes work outside of your nervous system, but also when they do work in your nervous system, sometimes they work in unconventional ways. Like they don't show up in vesicles. They're not packaged like in synaptic vesicles like dopamine might be. They might pass through and make changes in different ways than the normal synaptic release that we talked about. So there's things like carbon monoxide, nitric oxide, and then cannabinoids that you're not getting from marijuana. You're producing it yourself in your own body. Endocannabinoids in our body have kind of unconventional effects. And then finally, there's a category called neuropeptides. So neuropeptides are going to be large molecules made up of strings of amino acids. So not just like one amino acid like glutamate. They're going to have a whole string. And you've heard of some of these: oxytocin, endorphins, opioids, peptides that influence your gut biome, substance P that affects pain perception. These larger molecules are called have a category called neuropeptides. And these are things that can be released out in your bloodstream as like hormone action, but they can also work in your brain. So when they work in your brain, then they're neurotransmitters. When they work in your bloodstream, then they're hormones. Your book breaks down some things that we covered in the last video and then applies that to neurotransmitters here with 7 steps of neurotransmitter action. You can go ahead and pause the video to review this if you'd like to. We're not going to walk through it all once again because we've covered this already, but this is how those neurotransmitters are going to be involved in the synapse from being synthesized either at the synapse or being transported down microtubules, right? Storing them in vesicles. Some of them might be degraded before they make it to the synapse, releasing them into the synapse, affecting autoreceptors, affecting postsynaptic receptors, and then being taken back up or degraded. So those are some of the steps that we talked about last time. Each of those neurotransmitters, except for the unconventional ones, are going to be involved in these steps. So dopamine is going to be synthesized, dopamine will be packed in vesicles, dopamine will be released as exocytosis, dopamine will affect autoreceptors, it'll affect postsynaptic receptors, and it'll be taken back up or degraded. Cool. Throughout this whole process, psychopharmacologists have worked to develop drugs that are going to influence synaptic transmission of these neurotransmitters. And the big thing I want you to know about those drugs right now, we'll talk about specific drugs and specific conditions later. The big thing I want you to know is that some of those drugs are going to be called agonists and some are going to be called antagonists. Okay? Agonist is a term for any drug that facilitates the neurotransmitter. Antagonists are any drug that reduces the neurotransmitter's effect. So, as examples of agonists, we have L-DOPA. So L-DOPA, we take it as a pill, and it can cross the blood-brain barrier and then be synthesized into dopamine. So I take L-DOPA, I get more dopamine. That is an agonist because it facilitates dopamine by creating more of it. Easy peasy, right? SSRIs are also agonists. They're going to agonize the effect of serotonin. And they're going to do this by being reuptake inhibitors. Let's walk through this backwards. SSRIs inhibit reuptake of serotonin selectively. So how does this facilitate serotonin? Well, if you remember what reuptake is, that's recycling the serotonin back up into the presynaptic terminal. If I inhibit that, if I block reuptake, where's the serotonin going to go? Well, it's going to stay in the synapse and it'll have more activity. So there are SSRIs that are used oftentimes to treat anxiety disorders and depression, depressive disorders. And what they do is they block reuptake of serotonin, so you get more serotonin activity. Okay? And there are some consequences of more serotonin activity that seem to be effective for treating the symptoms of depression and anxiety. Cool. So this might be a little confusing because it says inhibition, but it's inhibiting reuptake, which means more activity. Antagonists block neurotransmitter effects. Breaking this down with some examples, there's a variety of chemicals that block acetylcholine. Atropine, curare, and Botox all block acetylcholine. Curare is a poison that you can put on the tip of an arrow and shoot at somebody. And Botox is a poison. It's botulism toxin that people will oftentimes inject into their faces or into their skull. It can treat migraines, but it can also paralyze the muscles in your face so that you don't have wrinkles anymore. Okay? These block acetylcholine activity. If you remember, acetylcholine goes to your muscles, right? So if I have a poison in my face or in my body and it blocks acetylcholine, right, then I'm not going to be able to move my muscles anymore. I'll get paralyzed. Cool. So that's an antagonist. It blocks acetylcholine. Interestingly, there's a third drug called atropine. This is going to block acetylcholine, but it's going to do it in your parasympathetic nervous system. If you remember, the parasympathetic nervous system calms your body, right? So parasympathetic nervous system slows your heart rate, slows your blood pressure so that you can come down from like a fight or flight response. If I antagonize my parasympathetic nervous system, then I won't be able to calm my heart rate. My heart rate will increase. So I get an excitatory response. My heart rate gets boosted. My blood pressure goes up. My pupils dilate. And so people use atropine if you've been poisoned, right? If poison is causing your heart rate to drop, or causing your other issues where you're getting lowered activity, your parasympathetic nervous system is going too strong, you can inject atropine, and so then you can recover from that poison. Or if you're having bradycardia, your heart rate's too low, you can boost that heart rate with an atropine shot. You can also do eye drops that have atropine in them, and it'll dilate your pupils, and then an eye doctor can see inside your eyes a little bit better. So in this case, it's important to remember that when we say it's an antagonist, it's antagonizing the neurotransmitter. It's not antagonizing psychology, right? So in the case of curare and Botox, it's antagonizing the effect on muscles, right? But in the case of atropine, it's antagonizing our parasympathetic nervous system. So we're actually getting more activation because we've antagonized calming, right? If that makes sense. So when you're thinking about this, is this drug an agonist or an antagonist? Don't think about whether it facilitates psychology. Think about whether it facilitates the neurotransmitter itself. Finally, just pointing out that your book has a figure that then points out antagonist and agonist drug effects at each stage of the neurotransmitter action. Now, I don't need you to memorize all of these, but walking through the examples that we just provided, you can see L-DOPA facilitates synthesis. It has an agonizing effect by helping neurotransmitters get synthesized. SSRIs are going to inhibit reuptake, right? It's going to block the reuptake, keeping neurotransmitters in the synaptic gap. That's an agonist. It makes for more serotonin activity. Curare is going to block the receptors down here. This is how curare works, that poison. It blocks acetylcholine receptors so that acetylcholine can't have its effect anymore and your muscles can't work. And the big picture here is not to memorize all of these possible effects, but to keep in mind that you can have agonist or antagonist effects at each step of the neurotransmitter action, during synthesis, during packaging, during exocytosis, during reuptake, and during activation of receptors on the other side. So when you think psychopharmacologically, typically we don't just take a pill to help a neurotransmitter directly, but like you don't just take the neurotransmitter in a pill form. We're going to take some sort of a drug that affects one of these stages of the process, either agonizing it or antagonizing it. Okay, so that's something to keep in mind as we move forward. And that's going to be the end of the road for chapter 4. We'll see you next time.